A condition in which a single vessel overrides both ventricles is called transposition of great arteries, hypoplastic single ventricle, tetralogy of Fallot, truncus arteriosus. The answer is option D, truncus arteriosus. Truncus arteriosus. In this condition, the aorta and pulmonary arteries have a common origin and one valve. The option A, transposition of great arteries. What is transposition of great arteries? Transposition of great arteries. In this condition, the pulmonary artery originated from the left ventricle and aorta originated from the right ventricle. Hyperplastic left ventricle means the underdevelopment of the left ventricle, underdevelopment of the aortic valve or aorta. Next option is the tetralogy of Fallot. Tetralogy of the Fallot is a combination of 4 major heart diseases. What are they? First one is the ventricular septal defect. Second one is the overriding of the aorta. Third one is pulmonary stenosis. And the fourth one is the right ventricular hypertrophy. Ventricular septal defect. Ventricular septal defect is the opening in the ventricular septum or dividing wall between the two ventricles. Allow mixing of the deoxygenated blood and oxygenated blood. The next condition is the pulmonary stenosis or pulmonary obstruction, a muscular obstruction in the right ventricle just below the pulmonary valve, or the stenosis of the pulmonary valve. It obstructs the normal flow of the blood to the lungs. Next condition is right ventricle hypertrophy. Right ventricle hypertrophy is the abnormal enlargement of muscle mass of the right ventricle. Next condition is overriding of the aorta. The aorta is shifted towards the right side of the heart and sit over the ventricular septal defect and collecting the poorly oxygenated blood supply to the tissue. Intra-aortic balloon pump therapy is used for treatment of option A, congestive heart failure, option B, pulmonary edema, option C, cardiogenic shock, option D, aortic insufficiency. The answer is cardiogenic shock. Patients experiencing cardiogenic shock or reduced left ventricular function, mechanical circulatory support with intra-aortic balloon pump therapy increases the supply of the blood or oxygen to the myocardium and reduces the heart's workload. Accreditation refers to one of the following: making assessment, making care cost effective, ensuring quality, meeting predetermined standards. The answer is option C, ensuring quality.